I said, we were challenged last year to look at what happened in Canada with the PH1N1 vaccine. And as you well know, there have been many debriefs and many research, or not research projects, but just summaries of what individual provinces did. What we really were interested in, though, is what did the front line experience? What were their challenges? What were their experience? And so that's what we set out to do. As a first start, with the cooperation of the Canadian Immunization Committee, we identified, number one, they agreed to cooperate with us, which was very much appreciated. Number two, we used the members of that committee to identify the key content areas that they thought was appropriate, and also to use their expertise about their provinces in identifying key informants who would give us a good picture, both in terms of the intra-provincial organization and management and the very front end of it. The areas investigated include communication. I should have this big bolded and just flashing away. Communication, as you're probably well aware, was a huge issue for us and continues to be so. Interestingly enough, when we think about communication, we're always thinking about media buys and social marketing and from public health to the public, and that is a big challenge. And again, very interesting KT challenges there. But actually, what was a huge challenge for all the programs in Canada was internal communication, like how to communicate between the federal level, provincial level, and front end level efficiently in a really rapidly changing environment. That was a huge challenge, and a lot of strategies, knowledge should be developed from that. It could be. Inventory and distribution issues, like great that the vaccine was available so quickly, like it's a miracle. It's amazing. It's often presented to me as, oh my God, Canada just did horribly in the fall. But in fact, it's the first time ever in history, as you well know, sorry to do this to the converted, but it was a huge accomplishment to have influenza vaccine during a pandemic for the first time. But anyways, management strategies for supply and demand, particularly when the supply and demand was fluctuating. That was huge. Priority group implementation, that was big, and personnel type, facility type, et cetera, et cetera. These were long information gathering sessions with the key informants. And what I'm presenting here is just a short snippet of what we're calling the quantitative analysis. Now, believe me, I'm not going to be inflicting any significance and statistical, well, some accounting type of statistics, but our numbers were too small to really do any robust significance testing. We did carry out the interviews from June to September in 2010. They were mainly phone interviews, 47 phone interviews and 2 online responses. As I said, the interviews tended to be long. Everyone's terribly busy, and when we first approach them, they go, oh my goodness, if it only takes 15 minutes, okay, fine. So we said, well, listen, the questions often are open-ended, and your time management is up to you. An hour and a quarter later, sometimes we're trying to say, can we stop now? Like people had a lot to say. And interesting enough, if there were psychologists in the crowd, it might be an interesting group to go back to. It was almost like a post-traumatic stress syndrome debriefing and occupational health and safety issues, which we did not explore. We did group, for purposes of this presentation, the respondents into groupings so that we could actually present it. So, and these are the groupings. We grouped the Northern Territories and First Nations and Inuit Health together, the Western provinces together, the Atlantic provinces together, Quebec and Ontario will be presented alone for this particular morning presentation. We also were interested in the informant's role in planning or delivery. So were they managers or on the front end? And the underlying population served. The 2 areas that I'm going to present today in the time that I've got are just the vaccine supply and demand strategies and the staffing strategies.